the male reproductive system. In this video, I include the seminal vesicle, ejaculatory duct, and prostate gland. First, we are discussing about, or we are going to learn about the seminal vesicle. The seminal vesicle is a thin-walled structure, and the shape it is pear and 5 cm long and 2 to 3 cm wide. When the structure which is uncoiled, its length measures about 10 to 15 cm long. Here we can see a pear-shaped structure. It is called as the seminal vesicle. When it is uncoils, it is about 10 to 15 cm long structure. Then we are going to discuss about the relations of seminal vesicle. In front, it is related with the base of urinary bladder. Here we can see the urinary bladder. This pear-shaped structure it is called as seminal vesicle. In front relation, it is the base of urinary bladder. And behind relation, it is the ampulla of rectum, which is separated by rectovesical fascia. Here we can see a fibrous fascia is there, so which separates the urinary bladder and seminal vesicle from the rectum. So it is separated the rectum from the seminal vesicle. There we can see as fascia. So it is called as the rectovesical fascia. On medial to that, the ampulla of vas deferens. Here we can see the vas deferens. Then and close to the seminal vesicle, the vas deferens is enlarged. That widened portion it is called as the ampulla of vas deferens. Then on either side or laterally, which is related with the true ligament of urinary bladder, which contain vesicle plexus of veins. The true ligament which helps to maintain the position of urinary bladder. Then we are going to learn about the secretions. What kind of secretion which is secreted by the seminal vesicle. The seminal vesicle which secretes a thick alkaline fluid-like structure which mixes with the semen that contain semen. Here we can see a sample of semen. Then which is another peculiarity of that, this seminal vesicle do not help to store the sperm. We already mentioned that the ampulla of vas deferens which helps to store the sperms. Then the most of the quantity of semen which is produced by the seminal vesicle. The duct of seminal vesicle which joins with the ductus deferens. Here we can see the ductus deferens of vas deferens which is joins with the seminal vesicle to form a common passage, and that enters into the prostate gland. So that common passage it is called as the ejaculatory duct. Then we are going to learn about the ejaculatory duct. The ejaculatory duct it is 2.5 cm long structure, and it is a thin or it's a slender tubular structure which is joins to form joins with the seminal vesicle with vas deferens. Here we can see the seminal vesicle and it is joins with the vas deferens, and it is enters into the prostate gland. So this portion it is called as the ejaculatory duct, and it passes downwards medially. It is passes downwards and medially posterolateral to the median lobe of prostate gland and opens into the colliculus seminalis. At the colliculus seminalis, here is a raised portion inside the prostate or prostatic urethra. It is called as the colliculus seminalis, and on either side of the prostatic utricle, this small portion is called as the prostatic utricle, and on the either side of the prostatic utricle, there we can see two openings for the ejaculatory duct. This raised portion inside the prostatic urethra, it is called as colliculus seminalis. Then we are going to learn about the prostate gland. The prostate gland, it is a fibromusculoglandular organ or musculoglandular tissue which add the secretions to increase the volume of semen, which helps to increases the volume of semen, and it is located antero-inferior part of the pelvic cavity below the neck of bladder. Here we can see the urinary bladder. Below the neck of bladder we can see the chestnut shaped structure. It is called as prostate gland, and which is surround the prostatic urethra, which helps to surround the prostatic urethra. The shape, it is inverted cone shaped structure or chestnut shaped, and the parts are, it have a base, apex, anterior and posterior surface, and two lateral surfaces. These are the parts of prostate gland. They are the base, apex, anterior and posterior surfaces, and two lateral surfaces. These are the parts of prostate gland. Then the measurement of prostate gland, then transverse at the base region, it is 4 cm long, and vertically 3 cm long, anteroposteriorly 2 cm long, and its weighs about 7 to 16 grams. And this structure, the prostate gland, which is covered with two capsules, they are inner and outer capsules. The inner capsule is true, and which is continuously or completely cover the prostate gland, and the outer capsule is false, and in between that we can see the venous plexus. Then we are going to learn about the parts of prostate gland. The apex, which is directed downwards. First we are discussing about the apex. It is directed downwards, and the base, which is continuous with the neck of bladder. Here we can see the urinary bladder. This small portion is called as the neck of urinary bladder, which continues with the base of prostate gland. It have the surfaces are the anterior, posterior, and two lateral surfaces. Then we are going to learn about the lobes of prostate gland. It have 5 lobes. They are the anterior, posterior, 2 lateral lobes, and a median lobe. These are the 5 lobes of prostate gland. They are anterior, posterior, lateral, and medial lobes. These are the 5 lobes of prostate gland. Then we are going to learn about the relations of prostate gland. First, we learn about the superior relation. Superiorly, the prostate gland, it is related with the base of urinary. The base, it is related with the neck of urinary bladder. Here we can see that the superior relation, which is related with the superior or the base of urinary prostate gland, it is related with the neck of urinary bladder, and the surface, it is pierced anteriorly by the prostatic urethra as enters the prostate gland. Here we can see that this neck of urinary bladder, this continues as the urethra. The urethra, which is enters into the prostate, so it is called as a prostatic urethra, which is enters into the prostate on the anterior part of the base of prostate gland. That's superior relation. The inferior relation or the apex, it is related with the urogenital diaphragm. Here we can see some muscular structures. So the apex, which is related with the urogenital diaphragm. The anterior surface of urinary bladder, which is related with the body of pubis. Here we can see this, the body of pubis. Then the prostatic urethra, which emerge out at the lower part of the surface. Here we can see this. This is the anterior surface. It is related with the pubic bone, and towards anteriorly the prostatic urethra or the main part of the urethra which exit. Then the posterior surface, it is related with the terminal portion of vas deferens. The posterior surface is related with the terminal part of vas deferens and the seminal vesicle, where it is joins to form the ejaculatory duct. The ejaculatory duct that pierces the posterior surface and enters into the prostatic urethra. Here we can see that this seminal vesicle, which is joins with to form the joins with the vas deferens to form an ejaculatory duct that enters into the posterior surface, and it is joins with the prostatic urethra. Okay, then the rectovesical septum or Donvillers fascia, which lies between the posterior surface of prostate and rectum. Here we can see this fascia, which is called as Donvillers fascia. The lateral surface are overlapped by levator ani muscles and the few fibers of levator ani, which is called as levator prostatae, and which is inserted into the capsules of prostate. That are the lateral relation of prostate gland. Then the prostatic urethra. The prostatic urethra, it is the widest and most distensible part of male urethra. It is the most dilated and distensible part of male urethra. Its posterior wall is a vertical ridge, which is called as urethral crest, or it's called as verumentanum. At the lower end of the urethral crest, it is spherical swellings. That's the seminal colliculus. Then we are going with the applied anatomy of prostate gland. First, we are discussing about the prostatic hyperplasia. It is usually occurs after 45 to 50 years. It usually affects the median lobe, which enlarges upwards into the bladder, causing a reflex desire to pass urine frequently. That means the frequency of maturation. The projection, it is formed by the median lobe into the bladder. It is called as uvula vesica. So that's condition, it is called as the prostatic hyperplasia. Then the common condition which occurs in the male, it is called as a prostatic cancer or the prostate cancer. It is usually affect on the posterior lobe, which enlarged prostate can be palpated by doing the pre-rectal examination. We can put our fingers into the rectum and anteriorly we can feel this if any enlargement which occurs on the prostate gland or the posterior lobe of prostate gland. So then we can identify if the person is affected with prostate cancer or not. Then the third condition, it is called as a prostatectomy. It is a partial or complete removal of prostate gland. It is called as prostatectomy. They are the transurethral recession of prostate. The transurethral recession of prostate or the prostatectomy. These are the clinical importance of prostate gland. Then, thank you.